Bismillahirrahmanirrahim. In this video, we are going to talk about drug-associated crystals. There is no hard and fast concept in this topic. Things are very simple that the drugs you administer to your patient are going to be excreted in the urine. The drugs you administer in the body of a patient have different routes of excretion. Some are excreted through feces, some are excreted through urine. Those excreted in urine have the potential to form crystals. And that is why it is very important that you should review the patient's drug history while you are having the sample of urine of that patient. The most common examples of drug associated crystals are the sulfur drugs like trimethoprim and sulfadiazine. These drugs form sulfur drugs. As you can see in this image, these crystals are formed by this drug trimethoprim sulfa. And these crystals can take on variable shapes based on pH temperature. So there might be a slight variation, like when you see in the microscope that the sulfur crystals might not be exactly of these shapes, but variations might be due to these factors on which these crystals depend upon. Second thing is radiopaque contrast agents that you feed to your animal to have contrast radiography. These crystals are all sorry these agents are also excreted in urine, so they form drug related crystals in the urine. Similarly, ampicillin is a very common example, especially when you study this drug in pharma. You always come across this drug basically precipitates in acid urine and it forms fine needle-like crystals. So these are just three examples, but there are many more drugs that cause or that form drug-related stones. Up till now, it was all about all the crystals. We have studied or elaborated all the crystals one by one in each video, and these are some additional or sum up points regarding these crystals. So, number one thing is that cystine and urate crystals are radiolucent stones, so you are not going to observe or see them on the radiographs. The most common crystals in cats and dogs are struvite and calcium oxalate. The most common crystals in dogs but uncommon in cats are cystine and urate stones. You have to reduce the protein diet for the management of cystine, urate, canine struvites, and to a lesser degree in controlling or management of calcium oxalate stones. The general management for all stones is that you have to increase the volume of urine, keep the urine diluted so that the crystal forming substances get dissolved and they do not get concentrate and get precipitated and form crystalline stones. And this increased urine volume can be like achieved by two ways. Number one, increase the but we cannot do this as such in animals that just command the animal that he or she may increase drinking water. So like in animals or in vet medicine, we can only do this by increasing the moisture content of the food. That's the only possible way. There is other thing that you should reduce the quantities of crystal forming substances in urine. Then you can increase the solubility of crystal forming substrates. Like you can use urine alkalizers for the treatment of acidic stones like cystine and urate stones. And as far as alkaline stones are concerned, you should acidify the urine, for example, in case of struvite stones. So you just have to reverse the pH in which the stones or crystals prefer to precipitate. And last thing, that medical dissolution is possible for most of the stones except for the calcium oxalate. So guys, that was all about stones, urinary stones. In the next video, we are going to start the casts, urinary casts. I hope you have up till now understood everything about urinary stones. Still, if you have any query, you can comment down and do like, subscribe, and share.